Hi, if you're here, you're probably interested in learning my video course on auricular medicine, and I'm really glad you stopped by. So let me tell you what's inside the course and give you a little taste of how it feels. In this program, we go step by step through the entire ear, both functionally and anatomically, so you can truly understand how every zone connects to the body. Here, for example, I'm teaching the anatomy of the ear. First, let's talk about the helix, the outer rim of the ear. It starts at the root, travels upward as the helical body, then curves down into the tail and ends at the lobule. Root of helix. There's a small notch in the cartilage here that marks point 0. This is a key regulatory point in auricular therapy. Ascending helix. Below this section is the reflex zone linked to the sex organs. Descending helix. This area corresponds to the spinal cord's reflex zone. You'll see exactly how the different regions represent different body parts. You'll learn the precise location and meaning of each auricular point and how to find them with confidence. And here you can see me demonstrating how to locate a specific point. Self-heal point. Location: from the eye point in the center of the lobule, draw an imaginary straight line going laterally outward. That means horizontally away from the side of the head, about 2 centimeters from the tragus. This is the location of the self-heal point. Notice how we connect the explanation directly to a visual example. We also explore body-ear point matching, how acupuncture points on the body correspond to ear zones. And here, for example, you'll see how I'm teaching about the limbic system and the brain. Now we arrive at one of the most fascinating regions in auriculotherapy, the limbic system. This tiny area, just a couple of millimeters below the upper edge of the antitragus, holds immense clinical power. Why? Because this is where emotions live, not metaphorically, literally. When we stimulate this region, we're accessing structures like the hippocampus, amygdala, and cingulate gyrus, all major components of the emotional brain. Anatomical orientation of key points. We will start with limbic system. Located on the outer surface of the antitragus, about 2 mm below the upper edge. This is your starting point. Palpate gently or test with VAS. Use this zone when the emotional background is active or if you're unsure what emotional element is dominant. Cingulate gyrus. Located on the front, upper edge of the antitragus. This point reflects emotional processing and cognitive emotional connection. It's useful for patients who overthink, obsess, or feel emotionally disconnected. And of course, it's not just theory. You'll see practical clinical applications in action. By the end of the course, you'll see the ear in a completely new way, as a map of the whole human being, physical and emotional. It's a professional course, but also friendly, clear, and easy to follow. So stay with me, and let's explore the ear together.